Hello everyone, dear professors, colleagues, and also friends. Good afternoon and also good morning. Thank you so much for your interest in joining today's webinar, co-organized by Hong Kong U Medicine and also Euroscan. So I'm Shirley Lee, Assistant Professor from Hong Kong U Medicine. I'm also the project coordinator of SCAN 2030, which is a RGC Research Impact Fund funded project. So under SCAN 2030, we aim to use horizon scanning to understand the medium to long-term burden of chronic disease and care needs to 2030 in Hong Kong. And today is actually our second lecture series under SCAN. So similarly as last year, our first lecture we talked about how to use health technology assessment to inform policies in China. And then today we are going to focus on horizon scanning, which is more forward-looking, and we're going to share the experience in Europe and how to use the newly developed toolkits to inform our local policy makings, including Hong Kong and the Big Bay areas. So today our webinar focus on horizon scanning for informed decision-making in Hong Kong and the needs prioritization and research allocation through the life cycle of horizon scanning. So it is our great pleasure to invite two world-renowned researchers in horizon scanning areas, and Dr. Hans Peter, who is the Secretary in General from International Health Tech Scan, i-HTS Euroscan now. So Hans is going to give us more hands-on experience in how to use horizon scanning tools to inform decision makings in Europe. And we also have Max Old with us, who is Executive Director from Euroscan. And Max is going to walk us through the concept of horizon scan, what is the applications of horizon scan in Europe, and how this will inform us in terms of decision making in Hong Kong. And in detail, we have a very detailed 2 hours of rundown. Thanks for the organization team from Euroscan and also Effie to manage all of this. So we are going to spend 2 hours together to understand how to use horizon scanning to guide decisions on research on resource allocation by moving from a list of potential technologies to decisions. So in this 2 hours lecture, we're going to focus on a few concepts of horizon scanning. What is the difference between horizon scanning and HTA? And what is the examples of using horizon scanning in decision makings in Europe, and how we could adopt these decision toolkits in local practices. And after the lectures, we're also going to have around 15-20 minutes of interactive sections. And please do stay and ask us questions, and feel free to discuss any potential issues or barriers or solutions in our local settings. We'll welcome the more interactive actions among the panelists. Okay, so that's all my introduction. Without further ado, I'll pass the floor to Max first to have an introduction of Euroscan and also the two speakers. So welcome, Max.
Yeah, thank you, Shirley. I will share my screen. I hope you can see it in total.
Yes, perfect.
Good. So welcome to this webinar on horizon scanning for informed decision making in Hong Kong, needs prioritization and resource allocation throughout the life cycle of health technology, horizon scanning. As Shirley already said, this webinar will be provided by International Health Tech Scan, also known as Euroscan International Network. And we would like to thank also HKUMed for the invitation to share our knowledge on this topic today. And we would like to also thank you and to join us today. And we will guide you through the next 2 hours, as Shirley said. If we say we, I am Maximilian Otte. I'm the Executive Director of i-HTS Euroscan. By training, I'm a health economist and also member of a technical advisory group at WHO and project coordinator in different European funded projects, which you see here. The most important ones are listed here. We are located in Europe, so you can see here that the project focus here is mainly on Europe, but not only. WHO projects are also focus of my work. Hans-Peter, perhaps you can introduce yourself.
Good morning. You can see my name. I'm a public agent, but I'm on a sabbatical, working for the federal government here in Germany, and I'm also the Secretary General of Euroscan. Euroscan has been founded in 1996, and since 2016 we are a legal entity in Cologne, based in Cologne, Germany. Nevertheless, Euroscan is not a European action. It's now a global action. You will see it soon. And I'm very happy to share as a Secretary General here, because we are doing projects from Malaysia to Brazil, from very much northern Europe to Adelaide in the south of the global. And so it's not an issue. Whatever you want to ask, as the head of HTA in Germany, I hope I can deliver any kind of answer to your questions. Thank you.
Thank you, Hans-Peter. Before we start and go into detail, a short disclaimer. With this presentation, we are representing the ideas of the non-profit global network i-HTS Euroscan. As Hans-Peter said, we are a global network, not only located in Europe, and we have no notable conflict of interest affecting this presentation, other than the belief that the public health system and universal health coverage are the fundamental basis for better health outcomes and better society. The objectives Shirley has already shared with you. So the focus of the webinar will be first an overview about horizon scanning and activities globally. As a global network, we can show global activities. We will describe horizon scanning as a tool to identify and prioritize technologies. We will then explore the environment, which is very important. We will show it later on. And then we will introduce the new Toolkit approach as a collection of concepts and tools which are very much relevant for horizon scanning and what we say and what we name early awareness and alert. The agenda for today: first, we will describe what horizon scanning is and how it can be used as part of the so-called early awareness and alert system, EAA. Second, we will describe how horizon scanning and early awareness system contributes to reimbursement and regulation, because this is where it comes from. Then we will broaden up the view to describe how early horizon scanning and early awareness contributes to other areas beside health, based on the approach of health for policies. What this is, we will describe later on. And after this, we will describe horizon scanning and early awareness, how it can be done based on the toolkit Euroscan i-HTS has developed and updated over the years of existence. So, and finally, we will go into practice, showing some countries and some examples to show you the different approaches and the different organizations which are dedicated to horizon scanning activities around the world. And as Shelley said, you're more than welcome to raise all your questions after all in the interactive Q&A session. HS Euroscan International Network is an international information network on new and emerging technologies. What has started as a collaborative network of member agencies for the exchange of information on important emerging new drugs, devices, procedures, processes, and setting in healthcare has now become a global network of public organizations and individuals which are dedicated to health technologies in general. So there has come a change over the years. I will come to this on the next slides. The global effort, which we are now describing here, has started in the early 90s as a club of HTA agencies in Europe mainly, which came later on without the club of agencies were not a legal institution. The legal status as Euroscan International Network, which you can see in the middle, has established as a non-for-profit legal entity in Germany in 2017. to be able to act in any kind of collaboration with other organizations like WHO, and to be engaged in public funded projects. So at the beginning, we were only a loose club of organizations which are interested to collaborate. So nowadays we are a legal entity under the name Euroscan International Network. Over the years, as I said, we became a global network. So we got member applications from Asia, from Latin America, from Africa. And you can imagine that the term Euroscan International Network is not reflecting this. So in 2021, we decided to establish a new brand name, which is International Health Tech Scan. So in any way, when we are going to the presentation today, you will see that there's Euroscan International Network or International Health Tech Scan. And this is the same, and you see here the difference. So it's just the differentiation between the legal name and the brand name. What you can see also is some of the members of our network. So you can see these are all public organizations, either agencies or academic institutions. And we have also individual members which are dedicated to horizon scanning. We will come back later on this. When we are going into detail about organization, you can differentiate 3 areas. The first area is i-HTS, International Health Tech Scan, as a non-for-profit network of organizations. Only public organizations can become member and individuals. So no industry organizations can be part of the network to ensure that the organizations which are part of the network are still independent, because they are supporting decision makers in the public field. And that's why we have decided only to include public organizations in the membership. Then the second element is HINT, Health Innovation and Technologies, which is a public central listed open access journal to support mainly applied science approaches in the area of health. And then the newest part, to enable our members also outside of Europe to be engaged in different projects which are not part of their region. So for instance, European projects, and to engage people from Asia inside the projects. We have founded i-HTS Science, our project management organization, which enables the members to be engaged. What we want. As a global network for information sharing, we are not in need of any kind of boundaries. So to support the work between the agencies, organizations we are dedicated to, we need a world without boundaries. When we have a world without boundaries, we are sharing data, information, and knowledge to raise awareness from one context to another. So which means that we have established methods, tools to be able to gather information on new and emerging technologies very early, to share this information between the countries, contexts, to make awareness, to enable the context to make the needed adaptations, because information might be something which is global, but the decisions behind and the methods and tools need to be adapted to a context. This needs to be reflected, and we are supporting this. And this is something which came mainly also later. We are not only dedicated to health, but we would like to support also the development of wealth, and the combination is most important. Who are we? Here you can see we are not just the network, we are also supporting and connected with different partners. For the support of knowledge exchange, we are not limited to our membership. We are also collaborating with different MOU partners. For instance, Health Technology Assessment International with 65 countries inside, INATA with 56 countries inside. We are dedicated to the Pan American Healthcare Organization in Latin America, WHO, Redetza in Latin America, OITV Pathway, I for Kids in Europe, which are dedicated to support innovators in the field, mainly in the field of pediatrics, but also in other areas where support is needed to enable innovators to come into the market. We are also proud associate member of HTA Link since 3 years, which means that we are continuously part also of the HTA Link conference. Also next year in Singapore, we will present what we are doing. So looking forward to it. We are also, since last year, official stakeholder of the European Medicines Agency, EMA, mainly in the area of advanced therapy medicinal products, like gene therapies, and official stakeholder of the European Commission in the area of health technology assessment and the establishment of the new regulation in Europe. Such a global effort can be described with this famous quote: the drug itself has no side effect, but the number of agencies needed to prove its value may cause dizziness and nausea. If you think that you have understood the local mechanisms, and this is an experience we made every day, if you think you have a clue about how specific contexts are working, you are every time taught that, and you realize that new organizations and agencies are very much important to consider when it comes to decision making on a local basis. So this is every time to reflect that you have only a limited view how things are working on a regional level. Why this webinar? Shirley has also introduced. The webinar is part of the SCAN 2023-2030 initiative of Hong Kong, and together with our colleagues from the Newcastle Innovation Observatory, which are very much focused on with their special knowledge on artificial intelligence, we are supporting the initiative with capacity building based on our experiences from Europe and from the other areas around the world. So I will not go into details here because Shirley has already mentioned it. So now we are coming into the content. Horizon scanning and what it is and how it can be used. Perhaps one of the first impressions if you hear horizon scanning for the first time is this. This might be the answer on other contexts, but not on this webinar. Here we are talking about horizon scanning as part of the realm of health technologies. So in this context, horizon scanning, based on the glossary we have established, is the systematic identification of health technologies that are new, emerging, or becoming obsolete, and that have the potential to affect health services, and/or society. And if you think this is all, it's not. So what you have to do is you have to reflect different other concepts which are connected to horizon scanning, like health technology assessment, early awareness, which will most important aspect also of this webinar, the re-evaluation and disinvestment of technologies, foresight, early warning systems, health service market, and demands. So there's a big framework or environment you have to consider when you see horizon scanning. The principle behind horizon scanning is every time the question, when does what emerge to whom? So what you can see here is that horizon scanning is much more depending on the whom. So the customer and the spectrum of customer could be very differentiated, and it has extended over the years. But this I will describe on the next slide. Step 1. To reflect to what horizon scanning belongs to and how it can be used, it is a good idea to go back in the time. The first discussions about the focus on technologies, which will come up in the future, happened in the 1980s already. In 1993, the URSS project in 1993 raised the idea to build an international network dedicated to the new and emerging technologies. This project And the idea behind was not successful, but in 1995, something was developed and an establishment which called Euroscan International Network. And this is something you have already heard today. So this was the first international network to support horizon scanning. This network, the Loose Club, was mainly supported by HTA agencies, and you can see here the purpose. The idea was to organize the workload of HTA agencies because you can see what is coming up, and then you can better plan what you have to do and when. Then you can estimate the resources to be ready for technologies. You can connect health technology related evidence and trying to rank it. And with the network, you can share knowledge and you can avoid to do something again because you can ask your colleagues. So horizon scanning has seen as a product to better coordinate work of HTA agencies at that time. Then another project came up, the HTA project in 2020, in 2000, to support the priority setting of HTA agencies and to support impact assessments and to support the determination of positive and negative lists of services. So you can see there's also an involvement. Third step, in 2005, there was something which is called the DEAIG, the HAI Disinvestment and Early Awareness Interest Group, which was found also to integrate new stakeholders and their requirements, which could include policy or industry. This is something which is still there. So the DEAIG is is an activity which is co-hosted by HAI and Euroscan i-HTS. To additional aspects, additional aspects came into play. So horizon scanning has introduced in a new environment, which we call the early awareness environment, which reflects more stakeholder groups than before. And the discussion about the implication of new technologies and existing technologies came also up when we came to the conclusion that we have to also consider the re-evaluation of technologies when we are talking about new technologies. Step 4 was about to introduce hospital-based HTA and to reflect also and to support decision makers in hospital area to support and to be aware of developments which are coming up and they have to be aware of. So the purpose was just to prepare hospitals and the hospital setting to these developments and to reflect also the organizational aspects. Step 5, from 2019, the focus was on getting in touch with developers in health technologies. So we came back from the idea just to look on what is coming up. We came to the idea that developers should be early aware about legal and scientific requirements which they face with their product or technology. Horizon scanning became a product for any stakeholder within the life cycle of health technologies. On the public side, to decide which developments should be supported based on the existing needs and demands, and this was new, on the private side, so for instance, investors, but also innovators, to be aware about the most promising health innovations and to also to reduce uncertainties in investment decisions. So you can see the customer area and the various or the group of customers is extending over the time. And 6, since 2022, this is a still ongoing development. We are in the process of updating the toolkit, which was established many years ago, towards something which is called Open Innovation Testbeds, OITB development. You can see it here on the slide. So the question behind was now, on the one side, how to be aware what is coming up, but on the other side, what is the preparedness of the market or the environment which is implementing at the end or adopting the technology? So it becoming more a societal discussion instead of just focusing on the technologies and how to make them ready for a specific environment. What we have seen is that horizon scanning has become more and more a product within different environments. So as I described, we have changed from just prioritizing and organizing the work of HTA agencies towards different environments where it can be used to be part of a so-called early awareness and alert system. But this is something we will now describe. So when we have now seen the different steps in the history and why horizon scanning has become a relevant and important process, you can see here the principle. So you are starting every time with information from research and development, from innovators, from research and clinical study databases, but also from real world, not just from R&D. These are the evidence sources you use for horizon scanning to establish something which is called horizon scanning reports, which are describing specific technologies and their potential implications. So when you're combining these horizon scanning reports on specific technologies, you see that you have a list of technologies. And this list of technologies could be very long. And then you can see that the stakeholders come into play. So depending on the requirements and depending on the customer, the decision process and the criteria in the decision process might be different. So that you have at the end a priority list, which is dedicated not to all stakeholders, but to different stakeholders, depending again on the customer. So this, you can keep it in mind. This is the principle, the overall principle of horizon scanning as we see it as a product in a bigger picture. I've already said that there's more to be reflected when you're talking about horizon scanning. This environment of horizon scanning will be part of the next session of this webinar, and you can see here already the overall concept of early awareness and alert system, where we see horizon scanning to be implemented. So when we consider horizon scanning as part of early awareness and alert systems, it's like an umbrella. So here you can see it. Here you can see the umbrella, early awareness and alert systems, and all the ingredients you need. On the one side, horizon scanning to have at the end the list of prioritized products and technologies, and on the other side, you have to consider the stakeholders, the environment, values, contexts, which means where should the technology at the end be implemented, what should be considered. You have to consider priorities of these groups. And at the end, and this will be also part later on, health needs and demands as the basis for any kind of development to have at the end a sophisticated market for technology which is coming up. So I would like to hand over now to Hans-Peter to introduce the next part of the presentation.
Just a moment. Share my slide here. Yeah. Is there any question? Up to now, I cannot see anything in the chat. So if you have something, you can also, for any kind of reason, you can also ask in between, and then we will reflect it in our talk.
Yeah.
So.
Yeah, we can see you.
Good. So what we now come, how it is used in reimbursement and regulation. Once again, horizon scanning was developed by agencies for agencies first of all, but nevertheless, HTA is a decision informing a tool on health technologies. So when we implemented it since the late 90s, we have many more requirements as we've started. So at the beginning it was quite easy, but then it got more and more complex. So please don't be afraid. One of the complex was that at the beginning we just thought about we have to give information for, or we wanted to know when we do something. Later on, we have to reflect the whole life cycle of a health-related product. How it can be integrated into real world comes up, and we wanted to improve and to include more the developments which are in the world. So what we came to the conclusion was that we need this kind of life cycle where we come from research and development, go to HTA, then we are looking for how it is being used, and then you see the topic which many people do not think when they talk about horizon scanning. This is not the emerging technologies which are coming up on this part of the life cycle, but those technologies who might be influenced and already implemented and should be disinvestment, so re-evaluated what to do. And this is then also leading to the issue with this kind of re-evaluation, we very often have then new ideas and can initiate new ways of doing something together. This is a life cycle we have developed at this time. Also, this is under development, so this will come up soon with a new version. But the principle here will be continued. And this is also something what we want to avoid with everything. So hype and reality. So if we implement something, we have to avoid that things are coming up without control just because it was listed in journals, newspaper, lobbyists run to politicians. So we got under extreme pressure, and with our forecasting of technologies, groups like artificial intelligence, or with specific kind of technologies, where AI, for example, is used, we would like to avoid this kind of hype and come more to clear decisions which are useful for a system. When we now talk about HTA and how horizon scanning can support this, then we start with the fact that, first of all, we have a so-called black box. And in the black box is research and development. Development is then split up in different kind of phases for pharma and whatever. Then we come to something which is called regulation. And at the end, we come to something which is called then HTA. The most important topic is here that if you go to regulation, in every country, you have to have a clear description of the intended purpose. So describe how a technology should be used, and then the regulators can say whether it's safe or not, because this is the task of the regulators in all countries to check for safety. When we invented HTA and implemented HTA, we thought we have to get more information about what is working in real life. So we wanted to know added values of a technology. So HTA was then the so-called sometimes fourth hurdle, just to check whether something and how something is working in real life. This regulatory HTA approach, this normally took 6 months. So in former times, we didn't look into R&D, but we look into regulation. So when we set up horizon scanning, it was then mainly 6 months, and so we could see what's going on. Now, in 25 years, we can see that we have much more knowledge about ongoing studies. We have to register studies which are relevant for regulation in study databases. So we can see much more clearer what's coming up. So from the 6 months at the beginning 1996, we are now going much forward. And for example, Newcastle, they even stopped 2 years before we come to the market with something. And this is just because of the fact that we have today more information, we have more great literature, we have more company announcement in business news to get a higher stock rate. And this is done what we are doing now, having the aim how to collect evidence and also how to validate the evidence. More early, the National Aeronautic and Space Agency in US has developed a system called TRL, Technology Readiness Level, to describe what's going on. And in the last 20 years, we also try to implement this kind of level description, because by this we could more estimate when is something coming up and what's going on. And then we have a forecast much earlier what's going on. Forecast because if you go to the beginning of TLR1, where you have an idea, you have no really one intended purpose. You are just doing something because you have an idea. And until TLR4, you do something, what is called then, develop something like a proof of concept, a prototype, and then you start with your development phase. So in research, you are still trying to see whether something can work or not in principle. In European regulation, there's the most important topic is TLR4B, where you make the first study, which is officially registered. Because if you don't do this, you cannot go to the development phase. So you needed to get allowance to start with the development. At this point, normally technology developers have not only one idea what they can do with the product, but they have many ideas. And so they have now to select the first time what will be the most promising intended purpose, the usage, and where do we go to market. And the most promising does not mean that it's most helpful for population, but it's mainly most helpful for the companies to do something. This is what the companies are doing, and then they prepare something to go to regulatory affairs, TLR7, and later on to market affairs in TLR9. But we have also seen that technology readiness does not mean that really something is useful for environment. And so this we have to improve. And how to do this was our big problem in getting access to something. So what we have to see that we do have now quite a lot of different kind of technologies. When we started, we had simple approaches: medical devices, pharmaceuticals, diagnostic. Simple, easy, just a simple thing. The pharmaceuticals had been mainly classical chemical substances, even if they come from herbs or whatever, but they could be described in a very nice way, and there was only one single approach. And the development and how to do it was clearly described. With medical devices, we had scissors, and at the end, we have more and more to include software, and then even complex software as artificial intelligence, whatever this means in detail, but let's just have this generic approach of artificial intelligence descriptions. In pharmaceuticals, we started also to develop combined drug and diagnostic tools. And because, for example, the legislation said whatever you do with a pharmaceutical, it will be then a pharmaceutical. So this kind of combined drug diagnostic procedures came up, especially because we got more biological tool services, and we got very expensive drugs. And then the companies wanted to show something that only to prove also their usefulness should also be used only in those patients they have selected. Diagnostics also developed. We have done biodata banks more and more coming up, and we have also the concept of omics, which from I was trained in medical affairs is totally different from what is nowadays the state of the art. And in addition, in combination with AI, we developed something called virtual twin, where we now can even test some of the issues in general before we go even to the patient. Genetic treatments and ATMPs are in the middle, because also there we do a lot of things. ATMPs, for example, offered by companies, sometimes are only allowed to do in licensed hospitals. Genetic treatment, as you know, is quite costly, and especially in rare diseases, is even extreme costly. And so we have to see that from the very simple approaches at the beginning, we have now very complex situations which are not longer just seen as a technology or a product better, but we have now very complex combined services which are even then also highlighted in public health procedures, which we increasingly use, because we cannot really describe in the old-fashioned way that if you use the technology, it's immediately done. You have to see also how it's implemented. This is especially because we say that we want to have more and more personalized services. And personalized services are quite difficult because it's also related to how to prove that something is really working. We have also then the situation that, as I said, with the licenses, that not every hospital can do whatever they want. We have to have a more structured approach where you have trained staff, good infrastructure, and the availability with the background to do something. And then, especially because of digitalization, we can see more and more that we have different groups in society. Some have access to all the knowledge and knows what to do and knows where to get services, and some are excluded. This can be of underserved population, for example, immigrants, but it can also be because of age and education. So we have a more complex situation in which we try to describe how the different kind of services can work in a society. But this complex situation shows that we have a lack in knowledge of combined procedures. We have a lacking of methods in evaluation of especially personalized medicine or small groups. So even in rare diseases, we do have this. You cannot include so many people in studies because there are not so many people. And if you want to change something, you immediately run into bias issues. What we also have is very much the problem of how we can adapt it to local situations. In Germany, we have 16 states. We have one federal government, and in every state, it's an own situation again. And the people in the north of Germany are different from the people in south of Germany. And if I look to China, it's even more complex because you have even more different groups as we have in Germany. Even in Europe, I think it's even closer than compared to China, the people. So we have to see how we do this. So we have a lot of lacking issues. Then we want also to see the potential impact of a product within a complex service and as a complex service. And at the end, here is the first time I mention this word, we want to see what is needed to really make something sustainable. The technology readiness does not mean that something can really be implemented in a sustainable way. Even with an HTA, you can describe the added value, but you cannot really describe the implementation as something which is sustainable and will be there for quite a long time. And it can also describe what is needed around the healthcare service as a business to do something. And we will come back to this later. So HTA, as you know, and in this way, we will support all the time HTA, is describing, can it work? Does it work? Does it work proper, better than others? And is it worth to pay for? So this is what we are doing. And that's why can it work is safety and efficacy. Does it work? The effectiveness. Is it better than others? The comparison. And then you come to an assessment, because only if you compare, you can assess something. And then at the end, you need to describe all the other aspects. And in all European projects, we have still every time the problem how to describe the organizational background, how to describe economy, and with the legal and ethical background, we are much more similar, but not the same in Europe or the rest of the world, like in Brazil and Latin America. And if you think about it, then especially the comparison between Europeans and Latin Americans, we do have very much social and cultural issues and political backgrounds which we have to solve. In economy, it's also different because we have the UK system, but we have also the classical German system. So in the UK system, you have the threshold discussion, which we do not have, for example, in Germany and France, because there we have to deliver and we have to serve the quality of life independent from the price, as long as it's really working. So in principle, safety and efficacy is leading to the market authorization, then the provision, and at the end, the coverage decision, which is needed in healthcare. So again, the classical approach, inline, leading to HTA for the reimbursement decision. But as I said, we have now included also whether something is really worth and is ready to be implemented in reality, so that we really come to this real world approach. Honestly, in 2000, I was trained by myself by David Banta, and he was coming from US, and he has been a very important person to implement HTA in Europe. He told us that exactly this kind of, that is working in real life and how it should be work in real life is part of it, of HTA. But due to the misuse of the term HTA and the needs of policy decision makers to have it as early as possible, we have nowadays a situation that we do HTA at a time when we just reflect on studies and what's going on. Especially if you are an early adopter. If you are a late adopter, you have time to see how it's working in other countries, and then you get already some kind of background about the health benefits in specific situations and contexts which you can reflect on. Maturity is not only whether it's working or not, whether the organization is working, but also to assure, for example, supply management, to assure that there's a business plan behind it. And if you implement something that the company offering this kind of product is not dying in 5 years or 2 years after you have implemented all the infrastructure. So that is for a long-lasting period and to make it sustainable. The other topic is that this is a stepwise approach. So it's a linear approach, and so it's one-way road, no way back, no discussion back, no information back. So the innovators have to see what the regulators want, and they are primarily working for the regulators. Then they come to HTA, and all of a sudden they detected that, oh, there's something else what we should respect to, and what we should have considered. And then they are losing years in development because they now have to make new studies. And at the end, and this is the valley of death normally, after HTA, something is totally lost in nirvana. And so by this, we have no more transfer into maturity. And then something is lost. And it doesn't matter whether it's good or bad. It's just lost because people have forgotten to implement the business. So we thought this makes no sense. And so we changed it. And nowadays we propose to have this kind of combination where you have then the system R&D, we do horizon scanning on emerging technologies, and then we make a list for prioritization for any kind of decision process. We gave it to regulators. We had a talk with HTA as we are HTA, and we also bring it into the business affairs. And the first thing which was implemented was in between the scientific advice. And the scientific advice nowadays even is a combined approach made by health authorities in the regulatory area as well as in the HTA to support innovators in a way that they get aware what's really needed if they go as well to regulation and to HTA. This can be done in different ways. We have tested it in a project called UNETA. And nowadays, EMA, the European Medicine Agency, is offering this, as well as national authorities are offering it. And in the new HTA regulation we have in Europe, this is even coming up as a service which we would highlight to be useful for getting information by those who are deciding about the facts which should be mentioned and tested within studies and delivered, so that the decision at the end, the red button, is really easy to solve. The real world impact is something which is going beside this, but for sure, if it makes sense for the development, and you save years if you go for scientific advice and do this. But you see, the most important topic is it's not longer a one-way road. It's now an interactive area where we are in discussion and raise topics with the innovators to make it as fast as possible and as good as possible. As Max already said, we have a conflict of interest, and the conflict of interest is I do not want that good things are laying there for years to be evaluated while people are dying. So the good things should come as fast as possible. And for the companies, it's also very important to see whether something is not working, so avoiding investment in something which is not really worth to pay for it. Coming to the black box. The black box is the research and development box. In fact, as I showed also already with the TLR system, we can split it up. We can split it up into the development part, which we more or less just described with the scientific advice, the different steps, phase 4, phase 1, 3, and 2, and later on phase 4. We can say all what's going on there, but this is, as we just discussed, coming to the decision whether something is regulated and reimbursed. Then we go to the research area, the unknown area. This is more than 2 years ahead of a product. And we got quite in this already mentioned open innovation testbed scenario, we got by the Commission the task to check how we can, the European Commission, how we can help innovators to see quite early what's going on. So in this area, we have then developed early dialogue and early advice. Early dialogue is more or less a very simple approach. So you have an innovator, he has an idea. Mainly the innovators are coming, for example, in medical devices from the bioengineer world. They have an idea, they tell you what the idea is, and you gave a little bit of feedback with the perspective of the healthcare system, whether it makes sense or not, whether it's done or not. And you will realize that at this time, the first most important topic is coming up, the common wording, because they're coming from the field in bioengineer. They don't have the word in the wording of HTA. And so this is very often then the first time you can improve collaboration by having a common language or developing common understanding. Then they make this proof of concept laboratory approaches, and then they come to a prototype. And with the prototype, you can already give early advice what's going on before to go to the level 4B, and to clarify also their mind in relation to which kind of intended purpose out of a set of different ways it might be useful. Honestly, all this kind of dialogue has been implemented not just because we are nice people and want to talk and have not enough to do. So as public agencies, we even wanted to reduce our burden in finding evidence. With this kind of dialogue, we are in cooperation with innovators, and we got then quite early information and see background information on technologies and how these are developed. What's going on, where's the pitfall, what is good, what is bad. Sometimes we can give hint about the population for future usage. And this gives us a complete new set of knowledge, a complete new set of interaction. And this we checked in these kind of projects, OTBs, and the result was as well from small companies as from big companies, very positive. So we have been very delighted to extend this and now to implement it in our toolkit. So we have nowadays interaction on early dialogue, early advice, and scientific advice, while the scientific advice is coming from those organizations who are at the end responsible for a decision on regulation or on HTA. You see a new thing here, the blue box on the left side. And the blue box is demands and unmet needs. Especially during the COVID time, we could see that we can overcome everything in this process quite easy if there's a high level of demands And this has killed any kind of bureaucratic approach because we have to do something fast, easy, and highly effective. So by this, we have more and more the task to implement demands and needs, also to describe, to give some hints for the decision makers what is really needed and not just what is described by a company, what should be solved. Also, demands and needs are extremely important to increase real-world impact. So, in fact, in both situations, as in research and development, we are not longer just producing the list for HTA bodies, but we are now also producing list of technologies, including demands and needs for other people who are responsible and have any kind of action in the area of developing products, developing tools, which at the end will come to the healthcare system or affect the infrastructure of a healthcare system or affect health in any way. So Max already mentioned health for all policies, but it will come later, and there it is quite important to go further. Okay, so now we have research development, we have this decision process, we come to the market, and then we have the implementation of appropriate usage. Here in the slide, you can also see that TLR is ending then. So appropriate usage, phase 4, is not longer really implemented in the TLR system, but it's a part of real-world impact and maturity level. So we have here mainly the topic of health technology management, social science and public health are involved, and regulatory science is still there because in this field of appropriate usage, we have now in Europe and as in FDA, the so-called periodic safety update reports issues. So after a specific time mentioned by the authorities, you have to prepare something again to show whether or not your product is really working in real life. Doing this, it's very often then the option that we come to the not emerging area, but the re-evaluation phase. And the re-evaluation phase, you want to see whether something which is listed in the coverage decision of a system is really worth to pay for, or, for example, a new technology has come up which is enabling you to do something different. So this is then done in the so-called re-evaluation phase, disinvestment about obsolete technologies. There you have to decide as in a country whether or not you are not longer paying for something, whether or not you would like to raise something else, and whether or not you can use resources in your country for something which is more promising to improve the situation of your people. One of the results of this process re-evaluation is also that you can describe unmet needs or new demands which you have not seen before, and you see if the blue box on the right side is the same as the blue box on the left side, then you have a cycle, and this is then really improving the situation of demands-driven healthcare system, describing what's going on, and that the products which are coming on the market are really fulfilling the needs in the market of the healthcare services. So you do not have to fight in HTA against products which are fashion, cool, whatever, but you can really see what is really helpful to do something. So you see that we have 3 phases until the market in R&D, then the implementation in something, and at the end, how to see how we can reevaluate and to see whether or not we should pay for it more often. And every time you saw that we do horizon scanning of what has to be deleted, so existing technologies which might be of need of re-evaluation, and you have the issue of emerging technologies as well, and you use this kind of horizon process and early awareness also for those who wanted to invest in something in the different areas and different topics. As Max said, we do have a quite different kind of level of stakeholders requirements, which has been occurred in the last 20 years, which is changing our opinion about what is horizon scanning and how horizon scanning can be implemented in the context quite dramatically. At the end, it must be important that we it's our policy that we do not want to decide something on a table somewhere else. So the decision has to be done by those people who have been elected to be and empowered to do these kind of decisions. So it must be in a local context. Yeah. And this is what we'd like to show here on this topic. I would like to ask you now before we go to the next step, because I think this is quite different from what you might have heard about the systems about early awareness and horizon scanning beforehand and where you can use it, whether or not you have now questions and would like to clarify some topics, because I think what many people expect is horizon scanning for emerging technologies, and what many people do not expect that you can use horizon scanning also for other kind of wherever there is the need of decision-making processes on technologies where we do not have the final evidence and proof of evidence what's going on, or in the disinvestment area where we have new technologies and have to decide which we would like to reevaluate to have a legal process, a transparent process, in which can also go to court if the companies are complaining about it and what's going on. And so if there's a question, please do it before Max is coming to the next chapter and show how it's been done. I see nothing in the chat. So, Max.
Thank you, Hans-Peter. I hope you can see my screen again.
It's there.
Good. Perfect. So Hans-Peter has opened the box. So how early awareness and horizon scanning can and has to be reflected in other areas than healthcare. And what we come now is how to reflect this and how to reflect things that are laying outside of healthcare, but should be considered when we have the ambition to develop health technologies which are sustainable, which are accepted, which are implemented based on their potential in a way that is most promising for a given healthcare system to have at the end the most and the best outcome. So as Peter has mentioned already, that these challenges are mainly emerging when we are in the implementation process. And when you reflect this, that we are not prepared in the implementation area on acceptance, on values, on preferences of people, on the environment and organizational aspects, you will fail. And you will not be able to implement a technology as you have planned it. So what you need is the capacity to be sustainable and to respect the cultural competence. And some years ago, there was something going on, the UN sustainability goals, which exactly reflect what is needed to reflect sustainability in the area of healthcare services, healthcare technologies. So any kind of single product, combined service, complex individual intervention needs to be at the end promoting health and wealth. Otherwise, we cannot establish sustainability. You can see here the sustainability goals of UN in detail, but what we reflect now is goal 3, good health and well-being, and decent work and economic growth, which are connected to each other. And to achieve sustainability, we need to think both together. This you can also see when you reflect the dark green white hat rainbow of WHO, which has published already 20 years ago or 30 years ago. And you can see here the individual aspects which are dedicated to health. And you can see here the general socioeconomic and cultural environment, which need to be reflected when you are talking about health. So you can see there's every time a connection between health and well-being and wealth at the end. So if we extend our view on these aspects, which are outside of the normal healthcare consideration when we are talking about regulation, when we are talking about reimbursement decisions, we are now in an area when it comes to implementation, where we have to reflect all these aspects which are relevant to be at the end sustainable. And what we are proposing here is to use horizon scanning and to use the early awareness and alert system to prepare this process to be at the end sustainable, and not only to see the technology and what is needed for the technology, but also what is needed to make the environment in which the technology is implemented prepared for the technology. And there's a nice quote by Martin Buxton. This is the Buxton law, which we are normally describing as the dilemma in which we are in early awareness and disinvestment. Even we are too early or we are too late. And our aim is to be as early as possible. But at the end, and this is most important, we cannot be too late. The most important aspect to reflect the sustainability goals is to achieve a healthcare system which is closer to the needs of the population. Hans-Peter has already mentioned that at any time you are considering the life cycle of health technologies, you have to be at the end, or you have to include at the end something like a feedback loop, so that you have at the beginning consider the needs and demands in the society in the development process, with the concepts we have introduced: early dialogue, early advice, scientific advice. You have the option as developer to consider these aspects, not only legal, but also needs, demands in the system. So you have a good idea of the market opportunities. And then to be closer at the end to the population and to learn based on whether technology is working in a specific context and what needs to be considered for the improvement or technologies which are coming up in the future, to articulate these needs and gaps, to be able to address them in this feedback process of learning, to reinvent something or to invent new ideas based on something you have learned in reality. And this is something where you cannot consider only healthcare aspects, but also societal aspects. This is what the sustainability goals of WHO and UN has taught us. What does it mean in the decision process? We need to consider the business environment. Hans-Peter has described it earlier on. We have to consider organizational aspects. If you are aware of health technology assessment, you might see, well, there's a domain called organizational aspects. Yes. But if we are broaden now our view, we have to consider organizational aspects which are dedicated to clinics, to general practitioners, etc. But we have to also to consider organizational aspects that are even abroad. So we have to reflect other policies and organizational aspects and criteria which are coming from there to be at the end able to describe something like a co-benefit. For instance, if you have a health technology which is going to be implemented, you can consider that this technology could be developed, manufactured, maintained in a specific context. And there you can see that this is not only affecting healthcare, but also economic growth and something we have already heard as wealth. So you can see there are more implications than just those we have started with. And this is the process where you can see scientific research and science and research support is one aspect. We have to consider decision processes in economic and infrastructure support, which is mainly dedicated to the implementation area. We have to consider investment support in public and private to make stakeholders aware what is coming up and to be able to reflect what we need and to bring it in the discussion. And on the other side, and this is called pre-commercial public procurement, which is something which is now heavily discussed in Europe, to be integrated as a public system into the development of technologies of different developments, which are all promising, but at the end, you have to decide what you need and what is most promising. And here you can articulate your demands and needs in a system to have at the end the most promising health technology, which is also accepted by the different stakeholders which are relevant for the implementation process of technologies which are sustainable. For the next step, I'm jumping back to Hans-Peter. Are you there?
Yes.
So what we are now describing, Hans-Peter will now share his screen, and I will introduce is how we do this. So we have talked a lot about horizon scanning and early awareness and the environment around it, but we have not described concretely what it is and how it is be done. And Hans-Peter will now share his screen and describe it more in detail how it is done.
I just try to get it online. It doesn't let me go to. Oh, I just have a little problem sharing. There it is. Okay. Once again, coming back to the idea what horizon scanning really is. If you got all what we have said up to now, then you could perhaps agree that horizon scanning, first of all, is a workflow. So within the workflow, we are looking for something, we are taking up values of decision makers, we are taking up values of customers, and we have to see and check for technology information, which we have to prepare in a way that in the priority setting for decision making or as decision directly, this can be used and be transferred. If you want to make this kind of workflow running, you have to be aware that whatever you do in the project management, according to project management, you have to see which kind of resources are available, which timelines you have to serve, how exactly and trustful your information should be, and how deep you have to dive for getting the right information. This you have to clarify because this is the only way how you can offer your customers information about when they can expect something. On the other side, you have also to adapt your processes and the methods according to the requirement of a decision maker. It makes no sense if you come up with something in 3 years when you need it in 3 weeks. So this is something what you have to see, but the principle of this workflow, this will be all the time the same. Policymakers will be extremely happy if you say what is needed by the customers, and especially in rare diseases, we are seeing that the small groups have extremely specified requirements. People are not really aware of coming out of daily life, and by this, nobody really anticipates what's going on. An example is, for example, in an island in the Mediterranean Sea, there was a population who had a genetic disease. All those people who have the genetic disease were not able to work, so they got money by the state. They were unemployment, as it was an island. There was also not a big industry. So most of the population were running on this kind of unemployment service by the state. Then there was a genetic treatment, and everybody was happy because now we could treat it. In fact, the acceptance had been quite low because it was not fitting to the requirements. As now, all those people who had been sick had to work, but got less money, and just because of treatment, so the acceptance was low and the implementation was then even worse. So this has to be integrated by customer including and demands. Stakeholder decision must be clear described, and we normally have a policy question. So what you do is you have to translate the policy question into scientific questions. And with the scientific questions, you as a scientist can work. You cannot work with the policy question because you cannot validate it and evaluate it. But if you are transferring a policy question into a decision, into scientific questions, you have at the end also to give a policy answer after you have collected all the scientific answers. If you do it for priority setting alone, then it must be, then the list of technologies must be accompanied by something what we call reports, or whatever kind of document this is, to describe the technology, the potential impact. And according, this document is mainly according to the decision makers' requirements, so that you can really offer this kind of information. So horizon scanning is a small workflow which has to reflect what is needed and should be in time, otherwise it's useless. The most important topic is the search for information. That's why we have the dialogues and whatever included. But what you do with the dialogues is something what is extended the explicit knowledge. Normally, you look into database. You use now, even as in Newcastle, you use AI tools to search for different kind of sources. And then in these kind of sources, you have explicit information everybody can access. If you are handling emerging technologies, but not only them, but even in clinical settings, you have very often experts who are doing specific ways, and they have knowledge which they have not published. So it's implicit knowledge, data, and information you should also be aware of. Especially the implicit knowledge is very often leading to acceptance issues. Either the healthcare professional are not accepting what you are deciding in an HTA office, what the decision was beforehand, or something like this. So you have to be quite clear in mind that this kind of implicit knowledge is extremely important. If you have emerging technologies, you very often have nobody else than experts. So you have to check it, and you have to find ways how you describe conflict of interest, for example, to make it clear for public and for other people why you're deciding. You do not have to follow all of this, because this is what we are discussing in Euroscan for our members. So where we do things and how we do things and how we are going together and what are we offering in our system, because we think that not everybody can do everything. So that's why we have the network, and the network is then helping each other with specific topics, because every agency, which we will see later on, has a specific kind of focus, and it's more like a puzzle for EAA systems on a global system, how we can combine and how we can bring things together to make it most efficient. I just want to mention two topics, for example, here, which are even not included in our system directly, because they're coming from outside. For example, we are trying to use the WHO classification systems, the family of international classifications, because they are free of charge, they can be used easily, and they can describe more and more. And while we have a classification system in the past, the development, for example, in ICD-11 is showing that we have more and more terminology-related topics, so it makes also more precise to describe something. On the other side, we have also tools from our members agencies, which I will not show here in detail. That's why I mentioned them. This is FLC. This is a set of database by the Basque Healthcare Organization to collect validation of published literature or any kind of other kind of evidence to make it available for reports. And then we have a pre-tag tool, which is by on behalf of the Spanish Ministry of Health, done by the Galician member of our society. And they have developed for the Spanish environment a prioritization setting tool, which then include all the information and all the values of people to handle this better. So we do have a very complex situation, but nowadays, in the time when we can connect everything via internet, it is not longer as complex and as difficult as in former times. You see FDA, AEMA, HPECT. Sorry, here's still CADATH. This is historically. So CDA is now included. And we are also connecting with the information sources to industry and companies. Here you see this kind of FLC, and you see i-HTS, which is the tool for prioritization setting and the information setting. In Spain, they already combine it in a web-based system so that people can more easily access. And this is exactly what we want to do. Specific kind of organization do specific kind of topics. And at the end, we all use common information to support decision-making in different areas. What we do have, we have a public area, we do have an internal area, because we have to develop also when we go into early advice and early dialogue, you have to have something which is a trusted area. You cannot just share everything, because you have to respect also IP protection, and IP protection is a quite important topic to assure that the companies who are developing something can get the money back, and that's why we have to share this IP protection. Just last week, when I was on the stakeholder meeting of in HTA regulation, the IP protection and when to share what kind of information to whom was very important, because we want to reduce the time to market. So sometimes we have to give information to people in a phase when regulation is not really finalized. And this is leading also to the needs that we have a trusted environment in which you can share information. This is the reason why a lot of information from Euroscan, for example, our information system is only for member area. This is what I mentioned. We, as Euroscan, we have developed the i-HTS info system, where we have different kind of information available. We have tech docs, which are related to the reports on a technology. We do have living books, and the living books are then describing specific kind of topics, which are under constant development. For example, the need for information retrieval. This is changing so often that it makes no sense to have a final list. So in the time when you need it, you have to see what is published by whom. And this is what we are bringing together in these kind of living books, which can be easily adapted and according to the actual things. You see that we also have other systems like the funding scanner, where we are trying to improve the methodological developments. So we are looking whether there is a need of some kind of scientific project and how we can interact with these kind of developments to improve the situation. This is how we came, for example, to the ORTB. This is coming up in a new project. So even in big projects, how we can integrate this kind of policy decision to connect it with evidence development and early awareness on emerging technologies or on obsolete technologies for re-evaluation can be implemented and be done. But this is done in partly the methodology is open, but the other areas are for member only. You have heard quite a lot about Newcastle. They are also part of this scan approach project you have in Hong Kong. Here, I just would like to show how they are presenting something. So they are using artificial intelligence to check for everything, and then they develop classical economic dashboards to show the benefit of something, and just they extend it to some kind of additional knowledge, what's going on, so that you can get an easy overview. Euroscan is, Newcastle is a member of Euroscan. So via this, the information is also going to the network, as well as information from the network is going to Newcastle system. So actually, we are developing, next year we have even a panel in HDAI about AI and how we can ensure that with AI you can increase trust, and in the service you can have common objective on what you have to pay attention to if you implement an artificial intelligence system, because at the end we want to exchange knowledge. And if we do not know how this knowledge has been developed by an AI system, the trust and confidence in this kind of information is low. That's why it's very important to have a set of common descriptions which we can share between the agencies, and then the agencies can decide what they want to at on the top to announce when they want to implement an AI system. But oops, back. The topic is also very often in the situation of explicit knowledge that people only look to US and PubMed and UK. In fact, there's a big group of people and agencies who are from non-English speaking countries. So we as Euroscan also partner of Redezza, which is an organization of American countries these countries from Latin America mainly, but also from Middle America and from North America. CDA is also a member of this, not the US. They are supported by the Pan American Health Organization, which is the regional office of WHO, and they are working together, and we are in contact with them. And our main member, who is also representing us in Latin America, is Brazil. But we have also other members. We are in contact with Colombia and Guatemala. Max, I do not. Yeah. So we have other people, and next year we are in Argentina, and so we have there quite a lot of people. They do quite a good topics, good work. But this is very often not well known because of language issues in direct communication as well as in published communication. Redezza is the Americas network of HTA groups, but we have the same in Spain because they have also a federal system. So they have many states and regions who are independent acting, and then the government of Spain have also implemented what is called Redez, so the Spanish system. And they are doing then also common approaches on HTA, but also on technology forecasting. And they are extremely active, and they do have also extremely good resources on knowledge about what is working in real life, because they have built up systems to be directly connected from the users of and providers of healthcare services, and they can see the outcome, and this is across all regions, so they can even see where something well done and where something not so good done. And this is something what we can get from the Spanish countries in a way that we have not seen from other areas. So they do exactly what we wanted. They bring up the topics. They bring up they take it with Pau is very much interested in this kind of health and wealth approach, where we see that something can be implemented in the country and have a benefit in the country to improve the infrastructure of a country, as well in science as in economy, and by this very helpful. We will see another example later on with the WHO. So it's very important, if you do something, to have the stakeholders in mind. And you see, we have so many different kind of stakeholders in professional organizations, in public organizations, in patients organizations, in policy organizations, and with the extension now to maturity level, also in business organizations, that there is never the option that one report is serving everybody. One question is serving everybody. So you have to see what are the most important topics you want to decide. And you will never decide about everything in rare diseases. So you have to select which kind of topics. You have to filter information. And this is done in relation to the requirements for decision-making processes. So as you see, it's not only the stakeholders you have to identify, but you have also to collect their values. Why are they deciding about something on a specific topic? This is not HTA. HTA is included, so all the domains of HTA are there, but it's not everything. So burden of disease, social relationship in a society, there are many things which are coming up, ethical values in a society. And this is different from context to context. So every context has to set up the own list of values and weighting between the values. And this can be done in Delphi processes and workshops to improve the whole situation and to get the knowledge for what you have to provide as in horizon scanning later on in HTA. We have had many kind of discussions about how to do it best. At the end, we come to the conclusion that actually we are promoting MCDA-based methodologies. MCDA is not replacing the domains of HTA, but it's an extension to catch all the other topics. So this kind of MCDA-based technology methodologies is working, and you see here the study which have been done, and to show that this is also implemented in different kind of public organizations in Canada by the European Medicine Agency, so for the European Commission, by IQWiC, which is the German Institute for Quality and Economic Effectiveness in Germany, supporting the Federal Joint Committee. In Italy, it's implemented as well. It is implemented in Hungary, which is very much focusing on MCDA-based information, but it's also in Thailand implemented. They do quite a lot of coverage decision based on the MCDA approach. So they take the domains of HTA as a core, and they add this kind of quantitative and especially also qualitative approach values into consideration to raise, on the one side, a clear, transparent decision, and on the other side, also to be able to act on what people would like to have and on what people would like to implement. And this kind of validation is quite helpful to raise acceptance. In Europe, because we like bureaucracy, we have also quite a lot of procedures describing how to do this. And the last paper is from the European Medicines Agency, which is describing how to be included as a stakeholder. Euroscan is a stakeholder, especially on ATMPs, but we are also stakeholder for HTA regulation. So we are very much checked to be independent and how to do something, just to be transparent. So if you want to have more of this information, how to include stakeholders, it's another topic. But we said also that we would like to have the context. You need the context. Without the context, you cannot really decide about something. So by this, for example, from WHO, we have evidence synthesis method guide how to describe context. The same is existing by OECD, how to describe policy settings for healthcare systems, and so that you get an idea that what we are doing in Europe or what we are doing in Germany is not the same as what we are doing in France and Netherlands, not in Denmark. And so we can see how we can then be able to transfer the decision of these areas with the documents out of these areas into our specific setting to make this understandable. And if you have no idea that economic approaches is not allowed even in Germany, you will miss it in the German report and you think it doesn't matter. They have missed something. No, it's because we are not allowed to do this. This is what you have to see when you are comparing systems and transferring data. But this is now also a little bit showing by Max again. Yeah, Max, I'll stop.
Yeah, I'm prepared. I hope you can see my screen again because I've switched. Yeah, you can see it?
Yes, perfect.
Okay, thank you. So going into practice, Hans-Peter has now described the process, how we see, based on our network, the process of horizon scanning in early awareness and alert systems. What I would like to show you now, before we stop having the interactive Q&A, and I've seen already some questions. So I would like to share some country examples. First, the National Horizon Scanning Center in the University of Birmingham. The center is not existing anymore, but it's very important because Euroscan as a network has been established, first of all, in the University of Birmingham. And they have established the first part of the methodology and the fundamental basis of what we are describing today as horizon scanning. So this was mainly the work of the University of Birmingham. And you can see here, this was the database the National Horizon Scanning Center has established at that time. So this was the first database to bring this knowledge together in one place. Another organization which is not less important was OSTEBA, the Basque Organization for Health Technology Assessment. They have established many additional elements which are very much relevant in horizon scanning. For instance, the monitoring of innovation sources, so the process of input, the assessment criteria, the prioritization of technologies. Also, they have established tools like FLC when you are seeking to have additional information about the quality of evidence. You can register in the FLC tool, which is established by OSTEBA. So to use the work of others, the assessments of evidence of others in your work to to avoid to do it again. This was something OSTEBA has established. There's something else, and this is also most important. There was a development by Euroscan and OSTEBA at that time to develop something like a standard impact assessment report document. Here you can see it as it is structured. This is the structure of the document. You are starting with the target population. You're describing a little bit the setting as Hans-Peter is describing it, or has described it. You every time need to describe the setting to go then into the technology description and to have at the end a dedicated report on the technology and their potential implications on a specific setting. This is the template for it. So here you can see an example of these documents. It's a little bit the content is the same. You can see it here. It's in Spanish, so if you are able to read it, this is an example. But then I've mentioned it already further on. When you are talking about early awareness and early awareness and horizon scanning, we have also to reflect disinvestment initiatives. So disinvestment has a bad image, to be honest, because it's seen as we keep something or we put something in, and someone who has had something will lose something. So it's has a bad image, but it's necessary, and it's not, and you should not see it as just put something away, but to have an early discussion about the reallocation of resources, which are every time reduced, or there's a specific limit of resources, and we have to have a discussion about these topics to reallocate resources. And MATAS, the Malaysian Health Technology Assessment section, has established a process which is really nice, beside other disinvestment processes which have is initiated by members of Euroscan i-HTS. And this is a paper which has published in November in our journal HINT, which is describing exactly what matters in the setting of Malaysia. And the colleagues have described that the missing awareness about the incoming of new technologies and the implication of it is mainly impacting the acceptance of disinvestment initiatives, so the reallocation processes. And what they described here, and you can see it also when you are looking in our journal, they describe what we have described. You need trust to change it, you need resources, and you need the relevant expertise and the political will. And these elements, beside others, please, you're invited to read the paper, are very much relevant when it comes to disinvestment. And there you can see that early awareness and horizon scanning are also relevant when you see how we need to shape our system. And this could be also something which could have relevance for Hong Kong, because you have specific aims with your system which you would like to establish here. So this could be also something you could perhaps adapt for your purposes. We have also already mentioned our colleagues from Newcastle. They are the experts in automation of information retrieval processes and to show it in dashboards and to inform decision makers. They have established also really nice dashboards on ATMPs. Here you can see it. It's also on the website of the colleagues. So there are many elements. Avalia T, our colleagues from Spain, as Peter mentioned, they are very much dedicated to priority setting. You can see here a tool, which is a very important pre-check tool, which enables you to prioritize and to compare technologies. This is a tool which is also free of usage. You can access it. You just have to register, and then you can describe. I have here established also an example for you. Horizon Scanning for Hong Kong. It's just an example. I have established it to show that you can here compare different products or different technologies based on specific criteria. You can decide how they are important and how you weight them based on your context in Hong Kong. This is also of relevance. Our colleagues from Conitech, I've heard from the colleagues that someone or some people from Macau are here. So the toolkit of Euroscan in the earlier version is also available in Portuguese. So it's also supporting capacity building in Lusophone countries. This is something Conitechers bring in. These are some aspects out of the document, so we can see Portuguese. The agency for the France initiative of horizon scanning and early awareness is something which came up also some years ago. They have established a concrete healthcare policy, and what they are doing based on this plan, which is also public available, is to better coordinate all activities which are dedicated to invest and to support developments very early, and to better coordinate the actions between the ministries in France. So you can see here our old picture, what we have seen earlier on, and you see that we are a network of different agencies with different tasks and purposes, and at the end they are all combined in one picture, which shows the approach we have established over the years. And this is thanks to our members that this is prepared in this good approach. And you can see it's modular. It's not needed that you need all parts. It's just what you need in your system. This is something you have to decide, and not we. We have to give you an overview. Our toolkit, which is now in the 4th version under review, the review process is ongoing. So as soon as this is ready, you will have the option to see it. As Peter has mentioned, the WHO compendium on innovative technologies for low resource setting. Here we have established first the normal evaluation of technology based on the criteria we have for health outcomes. And on the other side, we have asked also, or we have addressed also questions in terms of local production, maintenance, all aspects which might be to some extent of relevance, but at the end, when it comes to implementation and adoption, are even most important. This we have addressed here, and the WHO compendium is also available public. So I hope this presentation was fruitful, and the presentation was interesting for you. We have hopefully broadened up your view. We have hopefully answered some of your questions. Some of the questions are also in the chat, so we are looking forward to address them. But first of all, I was briefed by the colleagues that they have prepared a survey to evaluate also the session today, to learn what we can improve for the future and what was good. So I would like to invite the colleagues from Hong Kong, from the university, to share the link in the chat to make the evaluation first of all, before we start with the questions. Thanks.
Thank you very much, Max. So Effie, would you please share the QR code? Then we can get the feedbacks from our audience of the day. And also, if convenient, please also share the link from the chat. Thank you so much, Max and Hans-Peter, for the very comprehensive introduction about the life course horizon scanning from the very beginning and towards the recent development in the developing countries as well. So I learned a lot from today's talk. I think maybe we can start from some of the questions from the chat box. And then if anyone still have continuous questions, we can have interactive sessions face to by raising your hands. All right. Okay, so the first question is from Zhao Zimeng. I would like to understand where RCT process falls in the flow chart you showed us, assuming this is the most time consuming part. Where is the, yeah.
Let's go step by step. I saw it also, that was an F&A and not in the chat. That's why I didn't see the questions beforehand. The issue is here, we like to take RCT into considerations as early as they are available. This is sometimes, in sharing knowledge, it is a problem sometimes because the results are then not publicly in detail available. The RCT, this is also what we are reflecting in the early advice and in the scientific advice, because then we can do an RCT which is really focusing on the requirements of regulatory and reimbursement agencies, so that it's really helpful to have the right RCT and not to match something which is then at the end not helpful. So companies have spent quite a lot of money, quite a lot of efforts for nothing. So that's why RCT is important. On the other side, if we are in the very early phase of a research phase, we very often have no RCTs. We have just some studies, narrative studies, not really a big issue. And we do see an issue in rare diseases with RCTs, because there we have the issue that we will have more and more biased information, because we cannot do the classical way of doing this in the former, as we did it before. And we have there also the option that we can include other kind of study prototypes, like adaptive trials or whatever. So they are coming more and more up. And this we have to reflect in future times, especially in the area of rare diseases where we have not so many individuals we can test.
Thanks a lot, Hans-Peter. I hope this answered your question, Zimo. And we'll have quite a bit of questions. Shall we go through them together quickly?
Yep.
Yeah. So then the next question is from Joe Blaze. Is there a difference between horizon scanning and EAA? Are these terms
It's EAA system is the umbrella.
Mm-hmm.
So in EAA systems, we do have a workflow called horizon scanning. And so horizon scanning is part of an EAA system, as well as for emerging, as for re-evaluation. We need it very often, but we need it also for other issues. So whenever you saw a decision in our slides, the red button, we need something like a horizon scanning workflow in advance to prepare a little bit of evidence before to do this. So it's a workflow, it's a procedure in EAA systems.
It's a procedure in EAA systems. So am I correct? It's a more narrow concept or action plan.
Yeah, it's just a specific task, while EAA systems are offering a framework.
All right. Okay. The next question is from Tiffany Lam, from the chat box. Is horizon scanning scope to cover usually a specific disease state, compared with HTA, which is specifically technology focused? And if horizon scanning is for government resource allocation planning, any different considerations to take in settings that horizon scanning workflow?
This is what we described. Yeah, you can also.
Yeah. And in principle, what you can do, and this is the first question, would refer also to how you describe disease states. So in principle, what you can do when you're describing needs and demands in your system is to use the WHO classification systems, the classification systems ICD, ICF, and HE to describe the disease state. So in principle, my answer would be that it depends. If your customer, or if your purpose is to integrate specific disease status, you can do it. but it's not fixed. So it can be, but it depends on what you need. And the second part, this is mainly if you remember the process we have introduced as horizon scanning, it's very much depending on the criteria for the decision. So when the workflow in principle would be the same, but the criteria which are then deciding about the priority of technologies, this is changing. So the workflow is the same in principle every time.
And keep in mind with the classification Max just mentioned, we can also include traditional medicine.
Yeah.
So it's also very important that in the context situation that we can include what's really going on in traditional settings. For example, you have your classical Chinese way. We do have also herbal ways here in France and Germany, which are not reflected in explicit publications, for example, in PubMed, because the Americans don't have this in this way.
Okay, so that is also part of the innovation or technology list to be considered.
Yeah, and for example, in ITCHI, when we developed it for the WHO, the International Classification for Health Interventions, we have specific settings to be able to include this into the classification system, and by this to make it available across the globe. We did something on acupuncture in former times, and we have even to hire somebody speaking Chinese to get into this kind of information because it's not available in classical databases.
Thank you. So Tiffany, I hope this answered your question. And then maybe we could move to the next. Chen Junqiao's question, how to systematically solicit implicit knowledge from expertise, please? Systematically solicit implicit knowledge.
This is simple to answer. Thank you for the question. Just ask. So Hans-Peter has already said it. It's a matter of when you should share which information to whom. And if the overall aim is to reduce the time to market or the reduce to the time to get the technology to the patient, then you need trust, and you need a trustful environment. You need IP protection, and you need to make sure that the people which are interacting trust each other to then share the information, because sometimes there are no information in written form. So in principle, you have to ask, and you have a trustful partner. This is the answer.
Keep also in mind that the experts, we have two kinds of experts, or even three kinds. Those who are not interested at all, those who are against the colleague who is announcing the expert, and then the experts who are developed in connection with the companies and the innovators to do something. So you have two groups with conflict of interest and one group which is not interested in. So you have to make this very transparent. We talked about it last week and in the commission, and the only way we can see that you can really do it, because you have to do it in early phases, you have no option. You have to be extremely transparent in describing who the expert is. Only with this kind of level of transparency, you can overcome at the end problems in accepting this kind of knowledge. You are not systematically as an RCT when you do a systematic review, but this is not possible because you never know what is hidden. But you should be then at least as transparent as possible. Yeah?
All right. Thank you. Thank you so much. And yeah, that's a good insights about the knowledge and expert hub. I think we do need a transparent pool of talent. And then everyone have to declare clearly which part I'm going to contribute and what is the potential conflict interest.
Absolutely.
This
is the way we have to do it. Otherwise, it's not working. And then you have no acceptance. You will fail at the court because they can complain. Yeah, because companies will complain. And that's why you have to be very transparent and to argue why you are using it. It's more the, in principle, for scientists, I would say, use the classical qualitative approach how the quality of qualitative research is done, evaluated. Then you are on a good line, then you are safe, and then you can go forward.
Yeah, great,
Yeah.
great insights. Yeah, let's move to the next question from Kwan Peng. Thanks for the inspiring talk. I'm very interested about the interplay between HTA and AI. Could you please provide a concrete case about how the AI tools was applied in the process of the HTA? I think this might be referring to horizon scanning running by Newcastle.
We are in a very early phase.
This is a
As
very
you
early
realize.
phase.
Yeah.
So is
So
the
we
database already
tried-
openly available for public to use?
You can use what Newcastle is doing. You can already see on the web. So
Yes.
it's available free. You can see how they are doing something. You see the dashboard, and this could be the first use case of something, okay? Because they use AI to systematically, regularly update their system in the dashboard and describing something. The problem is that in sharing, you do not know why AI choose something.
Yeah,
This
there's no
problem-
validation yet, right?
And this is what we are still missing. And there we are trying to find ways how we can do this in a way that people can really transfer it to other systems, because this you need to be able to understand what's going behind it. So let me say, if UK is doing this, and as long as Newcastle is doing with their resources, I know their background, I know their context. If they now would combine it across Europe, I will get more lost, because then they use also other kind of context, and I do not know what's going on. But that's why we discussed in different kind of groups how we can set up the list for validation and to see what's going on, and to make
Yeah,
it
maybe I can add on very quick comments on this, because SCAN program also used the SCAN medicine from Newcastle University. And then at the very beginning, we come out a preliminary list of innovative medicine for chronic diseases. And then later on, we figure out, oh, there may be some validation problems. Then we use manually. We still have students and research assistants. They carefully checking all the approval labels from FDA, EMA, Hong Kong Drug Office, and also China FDA. So we carefully check everything, and then to make sure the information is correct. I think it's an exciting movement using AI for figure out all these innovations, but it's also at the very beginning stage. So we have to use it carefully, and then we move this innovative ways together. Yes, that's my experience sharing. Okay, then we go for the last question. The speaker mentioned Malaysia HTA is relevant to Hong Kong, and can you elaborate more on this? And any recommendation models fit Hong Kong healthcare system? I think this may be the major takeaway from today's talk. So how should we use the other HTA models adapting to Hong Kong? Our horizon scanning models.
in these cases, I have the tendency to describe what the others are doing and leave it to you how to transfer it into Hong Kong, because even if I have been there and given some lectures former times, the question is, I have no background really in Hong Kong. Okay, so what we can do is describe, I like extremely Matas and what they are doing. It's huge amount of knowledge they have and what you can learn. So in the interaction with Matas from Europe and with them, the obsolete technologies, the implementation of OATB, and all these topics had been quite done within their settings by themselves. So you will not see OATB. They have done it in another name as they need it. And as Euroscan, I'm quite happy if they adapt it with their own name. It's not a problem, but because we want to show, that's why we have a curriculum and to implement it and something like this. So Matas is very helpful, but we can explain how people have done something and why they failed, like in Germany, while we have been good. Yeah? But at the end, you have to decide what is fitting to your context, how the stakeholders are working and interactive, because at the end, they make decision and you are supporting decision-making processes. And if you do not reflect this kind of process, you will fail. Yeah, that's for sure. And raising awareness, how you interact with your population, where you are underserved areas, where you want to improve something, then you have to see how you can make it best for these people to accept it. And this is something we cannot say from here, from Europe. We cannot even say from Malaysia to Hong Kong, I guess, even if you have a better insight. You cannot do it when I talk with the colleagues from Australia, which we are using for these topics. Every time we have to stay back and say, this is a local decision. We just can help you with what we have done and where we have failed. Yeah. So sorry, it's not the answer you want to have, but in this way, I think it's a fair answer to see where we can help you to establish something on the one hand, but on the other hand, also to say, where is your task to decide about something?
Look forward more engagement together, because this is just our very first kickoff talking about HTA and hardware scanning, how to adopt this to Hong Kong. And I think in the following lecture series related to scan, we might invite other HTA expertise in the region and to share the experience, describe how the model works, and we will leave this to local policymakers and see, how this will fit the best to the system.
Yeah, this is another totally different kind of topic. That's why we have a project called ad hoc.
We should plan more next year.
And there we can implement something. It can help you also to bring something together.
Thank you so much, Hans-Peter. Okay, the last question. I think for the interest of time, we're already running 5 minutes over. Okay, so the last question.
I've already answered on it.
I already answered on it. That's fantastic.
But in principle, you have to differentiate between the legal mandate each organization, because you have to reflect public organizations, so they have a legal mandate, and you have to differentiate the legal mandate of the member organizations and the contribution to the network. And this needs to be differentiated. We have a big picture with specific elements, and all the members contribute to specific parts of it beside their legal mandate in the country. And the legal mandate describing the task and the horizon scanning process for them. So there is not the organization, but we have the network, which is in principle, or can cover every aspect, but it's depending on the members.
Yeah, and for setting up something in HTA, we have seen, I by myself as the head of the German agency have seen, if I'm not, that's why we develop all the other areas. If we do not really respect the other areas, our acceptance is not as high as it could be if we are open for the other customers and use our knowledge, use our methods to share knowledge for decision making. Yeah.
Thanks a lot again for all the insights of the day. I personally learned a lot. I think maybe as a wrapping up, may I invite Max and Hans-Peter to have one more summary, key takeaway of the day. My question is, how could we become the member of Euroscan?
Max, this is your task.
It's very easy, just to apply. We have a specific form. It's not too long, so the efforts are not too big. And you are more than welcome to apply. And the process.
So this is open for academic institution and also for HTA agency. Also, what about industry partners? They also welcomed?
They're welcome in projects, but not in the membership. So we
are
working in project with them because of the reasons we have described, but not as members.
Okay.
And if you want to have more insight, we are working on courses. We are working on the curriculum, and for all the academics now in the area, together with HTA, we are preparing more and more of these webinars of courses to help you to understand and to also to be there. So just get in touch and forget about just emerging. Think about the whole system. I think it's the most important, and we would like to invite everybody of you either to join directly Euroscan as a member, as an academic person, or as an institution, academic or hospital or whatever. As Max said, not industry. They can just act in projects. And then also next year we want to implement implementation research, because this is something also where we see that there's a huge amount of requirements which are fitting to our systems. So if you have a question. come to us and ask. That's the easiest way.
Thanks a lot for all the insight. May I take the final opportunity to thanks Max and Hans-Peter for these 2 hours of very insightful and informative sharing and very transparent sharing. I really appreciate your efforts, and let's look forward our continuous collaborations between Hong Kong and also Euroscan. Let's see how we can move this forward together. Thanks. I would like to thanks everyone to staying late today. Thanks for survived for these 2 hours. Thanks for everyone. Let's all stay in touch. Have a good day ahead and have a good evening.